You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. With us, we have an expert on the topic. We're talking about dental implants with Dr. Benefield. Dr. Benefield, welcome to the program.
Thanks.
Now, before we get into today's topic, and we're talking about dental implants to replace missing teeth, for people that don't know your practice, who's your typical patient and what are the different procedures you do?
You know, we have kind of an interesting practice. A lot of dental practices seems like do a few procedures here and there, but a lot of practices have gotten away from doing everything.
Okay.
We're the exception to that rule. We do, if it's dental, we do it. So it's hard to say we have a typical patient.
Okay.
You know, if we have a patient who's 3 years old coming in for the first time, that's typical for us. If we have a patient who's 85 coming in looking for implants for the, to secure their denture or whatever, that's typical. So if they have 2 arms, 2 legs, 2 eyes and a nose, that's a typical patient.
Now you do like wisdom teeth and root canals. I mean, you do everything under one roof?
We do.
It's kind of this new concept in dentistry?
It's not a new concept, but that's why a lot of patients come to our office.
But not a lot of dental offices offer that, though.
True.
Is that right?
That is right.
Okay.
Yeah. I can't tell you how many times I've heard a new patient say, I came to you because I've been going to 3 or 4 different offices to have procedures done, and I'm just tired of every time I need a root canal having to go to some unfamiliar office, or every time I need this or that. Patients love the fact that they can come to our office, and it doesn't matter if they need their wisdom teeth out, they need a dental implant, they need a root canal, they need porcelain veneers for cosmetics, whatever they need, they know they're going to be able to do it where they know us, where they're comfortable. There's no unknowns, and so it's not unfamiliar and uncomfortable for them.
Okay, so moving into dental implants, what are the different categories of dental implant patients that you see?
So, there's a whole spectrum. Some people are missing 1 or 2 teeth. They can be young, they can be old. That's a very different patient from maybe somebody who's missing all of their teeth and they're wearing dentures, and we're thinking about doing implants to stabilize their denture. So there's kind of a broad range of people, whether they're missing 1 tooth or 8 teeth or all of their teeth.
Okay, and at the top of the show we said no more dentures, no more traditional dentures. Elaborate on that.
So you and I don't understand dentures like a denture patient does. I've got my teeth, you've got your teeth, and so we don't even think about it. Denture patients, their whole life, or at least a lot of their life, kind of has to be structured around. Imagine if you went to a restaurant and you're looking at the menu and you're not thinking to yourself, what am I in the mood for? You're thinking, what can I eat that's not going to be embarrassing? In fact, I had a patient a few years ago come into my office, and she told me this horrendous story that happened to her. She went on vacation to Hawaii. You ever been to Hawaii?
Yeah.
I have not. So she told me about going to Hawaii, and she went to a luau where they were doing this Kalua pig, I think she said. So they're doing this Hawaiian barbecue out on the beach, and there's this big group of people, and she's friends with all of them, and she's a denture wearer, and all of a sudden, in the middle of whatever, her dentures actually fell out onto her plate of the Kalua pig that she was eating. And it was so mortifying for her. I mean, that happened in front of everybody. It was so mortifying that it ruined her entire trip to Hawaii. So I've never been to Hawaii. I'm sure it costs a lot. But imagine you go to Hawaii and your trip is absolutely ruined because your denture fell out.
Now, in Colorado, are there a lot of people wearing dentures? Like an upper or lower denture?
Ironically,
like thousands?
So I grew up in Grand Junction, and as a kid, you're not thinking teeth, you're not thinking dentistry or anything. So I had no idea, but being in Grand Junction now as a dental professional, I am amazed at how many people wear dentures.
Because you make dentures.
We do. There's tens of thousands of people just in the Grand Junction area that wear dentures. I would have never guessed it when I was a kid. Most people who don't think about teeth all the time would have no idea how many denture wearers are in our area.
So now, just so I understand this correctly, you could put 2 dental implants, like right up here in the mouth, right? Give them a full arch of teeth that secure in, no more adhesive, that snap in, snap out.
Yes. When you say 2, you're talking about lower teeth. People that wear
like
dentures.
2 dental implants, okay.
People that wear dentures know that their bottom denture is usually the one that they hate.
Okay.
My father-in-law, in fact, wore dentures. He got his teeth knocked out when he was like 20 years old.
Wow.
So he wore dentures for his whole life. He never ever wore his bottom. He always wore the top, and the bottom just didn't work for him, and so he just didn't wear it. So, of course, when I met him, I wasn't a dentist, and he would eat, and, I could kind of tell there was something weird about the way he ate, but he would smile, and he had teeth, and so I didn't think much about it. He never wore a bottom denture. People that wear dentures don't wear their bottom, or they have problems with the bottom, and so when you talk about two, we put two right down here on the bottom, and then that bottom denture clicks into place, and all of a sudden, it's just as stable as the top one. It's awesome.
No more. So they don't need adhesive with that.
No.
So when that's done, I think you say that it's one of those things where people say, "I should have done this years ago."
Yes. When somebody has worn or doesn't wear a bottom denture, when they've had a bottom denture for years and years and years, and then we do 2 implants on the bottom or 4 implants on the bottom or whatever we're doing, and they click their denture into place. If you could talk to that person 1 or 2 or 3 weeks down the road and say, it cost you this many dollars to get your implants. If we were going to pay you that money back, would you take them out? No way. Their world has changed. Their life has changed. They don't have to think about what can I eat and not be embarrassed about. They think about, what do I want to eat? In fact, I was doing a dental implant seminar a couple of years ago in Grand Junction. And this guy came up to me after the seminar, and he's like, I've had dentures, a top and a bottom denture, for a long time, decades. They just don't fit. My favorite food is steak.
Okay.
You've been talking to me about implants. If I get dental implants to support my dentures, can you promise me that I'll be able to eat my favorite food, steak? And I said, absolutely. So he came in, we did 4 implants on the top, 4 implants on the bottom. He already had the dentures, and so we converted those dentures. He didn't even have to have new dentures made.
You can convert their dentures.
You can. A lot of people don't like the way their dentures look, and so a lot of times we make a more cosmetic denture, but he liked the way his looked. He just didn't like the way they fit. And so we put his implants in.
Okay.
One of the things that he really wanted was to not have to have the roof of his mouth covered. And so he'd had this denture that, a denture covers the whole roof of your mouth. He didn't want to have the roof of his mouth covered. A lot of our taste buds are on the roof of our mouth.
Okay.
So he's wanting to eat this steak. He's wanting to savor his steak. He wanted to enjoy it to its fullness. So we took the roof of the mouth out of his upper denture to where it looked more like a horseshoe of teeth, because now he can just click it into the implants. And so I see him regularly now, and he always raves about, I just had my steak, I just went to the Outback, I just went wherever. Anyway,
so they tell you food stories.
Absolutely. Think about it. In life, one of the great pleasures of life is eating. If all of a sudden you went from, I get to enjoy my food, to I'm wearing these dentures, I hate them, to I get to enjoy food again, it's like you brought back this wonderful thing in your life.
Now, the way you do it, I guess the way it's normally done is they go to a surgeon puts the dental implants. Then they go to another doctor that puts the tooth on top and maybe somewhere else for the imaging. At your office, and correct me if I'm wrong, you do it all under one roof.
We do, and
what's the benefit to the patient?
We do it because it benefits the patient. Patients don't want to go to 3 or 4 different places and have different people trying to accomplish. Imagine if we're not talking teeth for a minute. Let's say you go to a restaurant and you have one person making one part of your meal and one person making another part. Your plate has to go to 4 different buildings before it gets to you. That's just kind of weird.
Okay.
For implants, the person that's gonna restore your teeth and make the actual tooth part of it, they know where they want the teeth to be. They know how your bite is supposed to be. They know all that. And so to me, it makes sense for that person to have control of everything from the start. We take your images so that we can see where your bone is, where everything is, and we plan right from part A all the way through Z, so you don't have too many hands in there. Our patients love the fact that they don't have to go all over the place. I have people specifically come to my office. I had a lady come in 2 days ago who said, I had to have my teeth out because I had gum disease. So it was a really emotional experience for me. I got my teeth out. Now I've been looking at getting them replaced. People told her she had to go to the surgeon, she had to go to different places. She said, I came to you because I have heard that I don't have to go to different places, and I don't want to go to different places. I want to come to one office and have everything done. And I reassured her that yes, we do everything here. From my perspective, that's the best way that we can serve our patients, to not have them go all over the place.
You also do sedation in your practice.
We do.
So they're obviously during the procedure they feel nothing.
They feel nothing. They don't remember anything.
It seems very painful.
You know,
a dental implant.
It seems like it should be. By all rights, in our mind, it seems like it should be, and it's not. You know, when I talk to patients, when a new patient comes in and is asking about implants, they always want to know, one of the things they always want to know is this going to hurt during, after? Implants, in my experience, I always ask my patients afterwards how they felt. It's kind of like a bell curve. You know, when you get grades in school, there's a few people that get A's, there's a few people that get F's, and most everybody else is somewhere in the middle. I've found that there's a few people that feel absolutely nothing. I mean, they felt like there was nothing ever done. That's kind of an exception. There's a few people who feel, holy cow, that was pretty uncomfortable. The majority of people, probably 98% of people, feel maybe a little soreness. They take some Motrin or something afterwards, but it seems like it should be terrible, and it's just not.
How old can you be to get this done? I mean, can you be 75 years old, 80 years old, and get dental implants for your denture?
You can be in your 90s and get dental implants
really?
for your denture.
Are they more likely to fall out at that age?
No.
I mean, do you have stats on that? I mean,
absolutely.
Really?
When you put a dental implant into bone, our bone, your bone, my bone, anybody's bone really likes the surface, the titanium surface of a dental implant, and so it just grows right up to it. It only takes about 12 weeks for that bone to grow up and attach to the dental implant.
Okay.
Once it's attached, there's no falling out, there's no getting an infection around it. It's there, it's part of your bone.
Now back to the denture wear for just a moment. And you said yourself that there's probably tens of thousands of people in Grand Junction that have an upper lower denture. If dental implants are so good to secure and lock down a denture, why aren't they all doing it?
Good question. A lot of reasons. You know, I guess an obvious reason would be they just don't know that it exists.
Okay.
They think, I've lost my teeth. My dad lost his teeth and he wore dentures, and so this is all there is. Maybe their teeth were such a bad experience when they had them, they were glad to get them out, and so they're done with dentists, they're done with everything, and they're dealing with their dentures, even though they may not like them. They're glad to be out of the dental office. A lot of people, I think, have a misconception of cost. You know, if you're wearing a denture and you're hearing some guy talking about dental implants, you're like, well, let's see, I had 28 teeth once upon a time, so if I'm going to get dental implants, I need 28 of them. And like we talked about before, you may need 2 or 4 implants to secure a denture. You don't need 28 implants. So a lot of people think it's going to cost a lot more than it really does. A lot of times I think they don't understand it. Maybe they think it's going to hurt a lot, or they haven't taken time to even sit down and talk to anybody about it, and so they don't understand what the option even means.
Is this the future then of dentistry as far as dentures are concerned, that in the future you think that there will be no more traditional dentures? They'll all be attached to dental implants? What are your thoughts?
I mean, it's reality right now. If we could take the 20 or 30,000 people in the Grand Junction area that have dentures and help them understand what a difference it would make in their life, to secure their dentures with implants, or to get permanent teeth and not even have a denture that comes in and out, without a doubt, they would do it if they really understood.
So if they knew, if there was a try-in period on the weekend,
yes,
try dental implants for the weekend, nobody could go back.
Yeah, in fact, I got to test drive a Toyota truck one time for a week. They gave me a week-long test drive. If you could do a week-long test drive of somebody who's wearing dentures and they click in, click out their teeth, or they replace their teeth with permanent teeth, there's no way they would go back to their denture. They wouldn't care.
Wow.
They would come up with whatever money it cost them to do it because it changes their life.
So Medicare does not cover this.
No.
Here in the U.S., insurance for the most part doesn't really cover the whole thing with dental implants.
Correct.
So you'll do what you can to make payments or make it affordable for them.
Yes, and that's a common misconception that, I think a lot of people just don't even look into it because somebody somewhere told them that implants are really expensive. We have a company that we work with that helps to finance their treatment so they don't have to, nobody has a big bag of dental money waiting to come spend at the dentist.
Yeah, it's the last thing you want to do.
Right.
Obviously.
And so, we work with a company that, if you need treatment and you just don't have the money to pay for it right then and there, it's no different than if you need a car. Most people don't go down to buy a car and pay cash for it. They're
finance it.
Yeah, they're able to get their car. They just have to pay it out in what fits their budget. Same thing in dentistry.
But what about the people that are headed for a denture, right? They have really bad gums.
Yes.
Are their gums too bad to support dental implants?
So this is actually a really common patient in my office. People come in and I've been asked a lot of times as we look at their teeth and look at their x-rays, they're kind of embarrassed, they're kind of doing this, and they say, "Tell me the truth, Dr. Benefield, is this the worst mouth you've ever seen?" Okay. I've heard that a lot of times, and they have no idea the worst mouth I've ever seen is 10 times as bad as theirs.
That guy lives in Denver? I'm kidding.
I don't even remember who that guy is.
No, I'm joking, okay.
Anyway, they feel like, wow, my teeth have been bad for all these years. My gums have had problems all these years. And so I don't think implants are an option for me because my gums are bad, so my bone must be bad, and everything's just bad. What people don't understand is the teeth are really the source of their problem. As soon as we get their teeth out, their gum disease goes away. Everything heals up and gets healthy. You'd be amazed at how good somebody feels afterwards when we get their teeth out and suddenly there's no more infection in their bone, there's no more infection getting into their blood and affecting the rest of their body. They have more energy, they feel great, and their bone and their gums get real healthy. Then we go in and put dental implants in place and secure their teeth on top of there. Their whole life is different.
You feel like you're transforming people's lives. I think you said you're changing people's lives. You believe that?
I firmly believe it. It's amazing to me to have somebody sit in our chair and watch a life-changing event occur. Sometimes you're watching a movie like a sports movie, maybe Miracle about the 1980 hockey team, and you get that feeling inside, that rush of emotion. I had a patient come in the other day, and she had, I'll try not to cry while I'm talking about this, okay? She had, her front teeth were really tipped forward. She had real bad gum disease. So imagine you're living your life and everywhere you go, your teeth are kind of forward, they're almost pushing out on your lips and your gums look really bad and your teeth are, you just be very self-conscious about that. So she came in the other day for her appointment. We had already done her consultation, and she expressed in her consultation how excited she was to feel better because she's got infection, things hurt, but she hadn't expressed in the consultation anything about the cosmetics of it. She wanted to feel better. So she came in the other day. She's excited to get her temporaries. We haven't even done her permanents yet. And so I asked her, "Are you ready for this?" And she said, "I'm so excited. I left work today and all my coworkers can't wait to see how it looks." And that was the first time I had heard her say anything about looks. It was all about how it feels. And so we did the procedure, got her front teeth out, which were the ones that were sticking out and real infected, and we put her temporary in place. And if I could have this feeling every day, life would be awesome. But we finished with the procedure. We sat her up in our massage chair, and she was just.
So she looked in the mirror for the first time.
Well, so I said, "Do you want to see him?" And she said, "Yes, I do." Keep in mind, she's numb. She's just been through this procedure, and I gave her the mirror, and I mean, she just melted in the chair. She
wow. So everybody gets choked up in the whole office.
Yes. My dental assistant was over there crying. I'm over here trying to fight back this lump in my throat because she was just absolutely melting in the chair, and she's looking in the mirror. It had been a decade since she had seen. So she
thought, what, she was like hopeless?
Yes. I mean, it had been 10 years since she had seen herself with straight teeth. In fact, we showed her the temporaries before we did her procedure, and she said, "Wow, they're really straight. I haven't seen straight teeth in my mouth since I got married." And so she saw herself 10 years ago when she looked in the mirror for the first time. So that was, I walked out of that treatment room thinking, no wonder I became a dentist.
So we're out of time. Good stuff. Good story. If a denture wearer, somebody with false teeth, goes into your office, what are their options? as far as dental implants?
So whether you already wear a denture or whether you feel like you're facing it in the near future because your teeth are just, your gums and teeth are bad, and so you know you're facing getting them all out of there. Some people feel comfortable with their upper denture, and so we put 2 implants in their lower denture because it just doesn't fit, and they snap it in, snap it out.
A full arch of teeth.
A full arch of teeth snapped in, so it's a lower denture. It just has something to hold it in place so it doesn't float all over the place.
Okay.
So that's option number 1. You snap it in, snap it out. Option number 2, if you want it to be fully supported in the front and the back, then we put 4 implants, 2 in the front, 2 in the back. Snaps in now. Every time you bite down, it's not pushing on your gums anymore. It's supported by implants all the way around.
Okay.
So that's more like teeth than having 2. So option number 3, some people don't even want teeth anymore that come in and out, or if let's say you've still got your teeth and you don't even want to entertain a removable option, then we do either 4 or 6. Usually on the bottom we're okay putting 4. I usually like to put 6 just because that's my personality. I like to make sure that there's going to be plenty of over-engineering involved. And so we put either 4 or 6 implants on the bottom after the teeth are out, and then we actually lock permanent teeth right onto the implants.
They can eat whatever they want.
Yes, absolutely. They can't take them out. You couldn't take them out if you wanted to. I can take them out if we need to clean underneath them or whatever, but it's like having teeth.
And by the way, how soon? I mean, what's the turnaround time? If everything goes just right, somebody watching this, they have no teeth. They have a loose-fitting denture. Okay. If they come in, if everything goes right, what's the turnaround?
If they want permanent teeth that are locked onto their implants, they'll leave the same day that we started with teeth locked onto their implants. Now that may be a temporary, that may be a permanent, but they'll leave that day with something locked onto their implants, and
with teeth locked onto their implants.
Yes, it's fast. It's amazing. So top teeth, if you're already wearing a denture, roof of your mouth is covered, you're tired of having the roof of the mouth covered, we can take and trim the roof of the mouth out of your denture to where it looks like a horseshoe, kind of like a bottom denture looks.
Okay.
We don't usually do 2 implants on the top for that because you're kind of fighting against gravity and things, and so we generally will only snap in, snap out on the top if we can put 4 implants. Again, a lot of people don't want something that's removable. On the top, we definitely put 6 implants, and then we attach permanent teeth, a whole row of teeth, right to the implants. They don't come out. You can't get them out.
Do they look real, by the way?
You would never be able to tell if somebody had that. You probably have seen a lot of people that had that, and you didn't know they had that.
I don't know about that. I always feel like I could spot, like either veneers or dentures.
I'd like to give you, I wish I had pictures of 10 people, 5 of them with and 5 without. I'd bet you that you'd be wrong on about half of them.
Okay, good. Then we are out of time. You know, we should mention, I went to your website this morning, and you have a bunch of videos.
We do.
And the patients seem to really like you. They say you're funny. They say you're, I mean, they actually like going to the dentist.
They do.
Because nobody likes going to the dentist.
You know, I would encourage anybody to go to our website so that they can see what our patients say about us.
Yeah.
That way they can kind of get a feel for, does this seem like the right office for me? We don't charge people for a consultation in our office.
That's
and so
nice.
It's very easy. If somebody goes onto our website and sees our patients talking about how wonderful their experience is or how funny Dr. Benefield is or whatever, and they decide, you know what, I want to go and just check this old house out and see what the technology's like on the inside, come see us. We'll schedule a free consultation. We'll take our x-rays. We'll just figure out what needs to happen to change your life. And then if you decide that's what you want to do, then we'll change your life.
So if somebody comes in, though, we talked about denture wearers, you know, what the turnaround time, but how soon can they eat? If everything works out right.
You know, I'm amazed with some people. I had a guy come in and he needed all of his teeth out, so we took all of his teeth out. We put a few implants in, but we didn't lock the teeth onto the implants. We were letting the implants heal underneath, and so we just set his denture over the top.
Like a snap-on?
No, it wasn't even snapped in. It was just a denture over the top while the implants were healing. He came in 2 days later, I think, and he was eating beef jerky. I mean, he was eating stuff that I was like, what are you doing? And he was comfortable. He was fine. And so, you know, when you say, how soon can somebody eat? If they're like this guy, they'll eat whatever they want right away. Usually people feel more comfortable eating a little bit softer stuff because, you know, there's some soreness involved afterwards, and so they're not going to be real uncomfortable, but you hate to take and just try to eat beef jerky right off the bat. And so it's, you know, it just depends on the person, honestly.
And how long and how long can they last? I mean,
a dental implant?
Yeah.
For life. When it's in, like we talked about, your bone grows around it. Once your bone has grown around it, it's with you for life. It's a permanent thing. People talk about implants, maybe it seems like an expensive thing. When you look at it's a lifetime restoration, a dental implant's probably one of the cheapest things you can do and get the most out of your money. They're amazing. So one other thing I'd like to say about price, because we do everything in our office, people find as they come to our office that we're able to pass some savings on to our patients. Maybe they've checked into having one of the big chains do implants and fasten teeth onto it, and then they come to us and we do the same.
Are you less than they are, or about the same?
We're thousands less. People look at the paperwork and say, now is this the same treatment that I was looking at the big chain? And it is. It's just because of the way we do things, we're able to pass savings. They don't have to go to a surgeon and to a restorative dentist and different things.
Is this the happiest group of patients in all dentistry?
Absolutely.
The people you give?
They're the ones that their life truly does get changed. If you do porcelain veneers on somebody and you give them a mirror afterwards and they're like, yeah, that looks great, and, you know, life is good. These are people who their whole life revolves around
missing teeth or
or infection or whatever. Their life is changed completely. It's amazing. It's awesome. I love it.
Thank you for coming on the show. Good stuff.
Randy.
Good stuff. Free consultation, you say?
Yes.
And if they want more, they go to your website.
Absolutely.
All right. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.